Good afternoon. Thank you all for being here with me this afternoon. Before I begin, I want to take a brief moment of silence to honor the Capitol Police officers who lost their lives as a result of the mob that stormed the U.S. Capitol building last week. These men spent their lives protecting the halls of our democracy. My wife, Kathy, and I are holding their families and loved ones close to our hearts at this time. Please join me for a moment of silence. Thank you. As I said last week, the chaos that erupted at the U.S. Capitol was the opposite of patriotic. It was undemocratic and un-American. When we do not operate together as the United States of America, this is what happens. And last week's events, to me, were a culmination of the last 4 years of a lack of leadership at the top. It can feel like we are more divided now than ever before. The chaos and collapse did not just happen last week. It had been developing steadily in the last 4 years. It at a far more rapid pace in the last 10 months. The divisiveness and lack of leadership has resulted in the lack of a unified national strategy to combat a deadly pandemic. It has pitted state against state on the open market, trying to secure personal protective equipment and testing supplies. It has left each state and local government in impossible budget situations, trying to provide critical services in a crisis without additional and flexible dollars. Except at this point, state and local resources are even further depleted than they were 10 months ago. It has resulted in the slow rollout of vaccines without a unified nationwide strategy. The same folks who have been struggling to provide for months and months are hit with a new massive logistical challenge. All of the challenges we face as a nation are combined and intertwined, and the United States is best when we come together, putting aside our personal differences to reach a common goal. And right now, our common goal must be to reach the end of this pandemic so that no more families mourn the loss of a loved one to this terrible virus, and to be able to transition to the full strength of our economy. And before I go any further, let me make something clear. I know there are many folks around the state and country right now, reading a letter written by the Nye County Republican Party chairman. It is an embarrassment to the entire state. Do I condemn it? You bet I condemn it. Language from party officials and community leaders that incite insurrection and violent uprisings and promote blatant falsehoods are especially dangerous at a time like this. The false allegations against the integrity of the election, which lack all evidence of fraud or wrongdoing, need to end, and end now. During this difficult time, Nevadans deserve decency, humanity, and respect for where we are right now. Whether the threat is real or perceived, it is horrid at a time that we're all dealing as a nation, with what we're dealing as a nation. As you're going to hear today, we're trying to get out our largest vaccination in the state and country's history. We have healthcare workers overwhelmed in hospitals. Most importantly, our children are watching. They're internalizing this. We owe it to them to do better. We can do better. I often think about raising my 2 girls as a single dad. As a parent, I can't imagine trying to explain to them what the nation is going through right now. These comments have no place in the state of Nevada. Today, I'm pleased to join once again by Candace McDaniel and Shannon Bennett from the state's immunization program. They will help provide an update on the state's rollout of the COVID-19 vaccines, including changes to the COVID-19 vaccination playbook and what Nevadans can expect to see in the coming days and months. As we have said from the start, this is a dynamic and fluid situation, and we learn more and more from the federal government each day about a vaccine rollout, about the challenges we're facing logistically, and what we can do as a state to help ensure vaccines are reaching Nevadans as soon as possible. We're being as transparent as possible with Nevadans during this time. Before we get to the update, I wanted to talk to Nevadans briefly about extending the state's current mitigation measures in place to help slow the spread of COVID-19. Our HHS team predicts it's likely we won't see the full impact of the holidays and gatherings in December until around 2 weeks from now. And we likely won't see the full impact of New Year's Eve and New Year's Day until the end of the month. Remember that this relates to new cases specifically. The impact related to hospitalizations and deaths will be further delayed. The reality is what trends now shows that the state, including Washoe and Clark, are still experiencing very high levels of disease burden. Even if cases decline or plateau, they're starting. Between holiday surges, community spread is high, and many of our hospitals are strained. It's for these reasons we will be continuing the mitigation measures that are currently in place. At this time, and for planning purposes, we are looking to keep these measures in place for another 30 days. But just as we've said since the start of the pandemic, we will remain flexible, and if situations change, there is always the ability to adjust. At the time I announced these measures, I called it a pause because I truly hoped it would only have to last for a short period. However, we remained at an all-time high, and due to Christmas and New Year's, our case numbers are likely to increase over the coming weeks. And again, increased cases lead to increased hospitalizations, which lead to increased deaths. In order not to add increased burden on our hospitals, we must remain under these strict mitigation measures and change our behavior immediately. We must double down. Under the continued mitigation measures, businesses like bars, restaurants, gyms, and gaming operations must continue to operate at 25% capacity under strict social distancing measures. Like I've said many times, there is hope on the horizon with vaccines, but full-scale vaccination will not occur until further into the year. In the meantime, we're setting record highs for COVID-related deaths, and our healthcare workers continue to ask us all to help Nevadans. This isn't over, even though I know we all want it to be. We are past the 10-month mark since our first case in Nevada. Over time, it's become easy, it's become numb to see the daily numbers. But we can't allow ourselves to do that. Now is not the time to give in. It's a time to double down for the future of our state. It's the only way that we'll recover. After all, vaccinations have begun. There are so many reasons to be hopeful for the future. On to vaccines. Before I turn today's presentation over to Ms. McDaniel and Ms. Bennett, I wanted to talk high level about our state's goals when it comes to COVID-19 vaccination efforts. First, we're focused on a science and policy-based distribution model that's reflected in every version of our playbook and will be reflected in the third version of the playbook being released today. Candace and Shannon will provide a more thorough update on the changes that have been made, but I wanted to provide a few highlights. Notably, our team has recognized the importance of prioritizing our senior population who have been hit hard by this virus, and we are developing plans with partners to help with this vaccination effort. But I wanted to note right now, one notable change is that the top priority under general population is 70 years and older. Previously, it was 75 plus. Now it has been lowered to 70 years and above. Again, we have followed guidance from the CDC, while also ensuring that our distribution model meets the specific needs of the Silver State. Secondly, our primary goal to ensure that we don't let any doses go to waste. We want to maximize every dose that comes into the state and avoid expired or unused doses. So far, our local health districts who are vaccinating healthcare workers in the first tier have done a tremendous job to make sure they're using every dose once vials are defrosted, and we need to continue that going forward. The immunization team that kept that goal in mind as they developed updates to the playbook. They listened to those at the local level who expressed a need for additional flexibility to adjust to real-life situations on the ground. I'm confident that these changes will help reach that goal. Additionally, we want to ensure that vaccines are distributed equitably across all populations, including our historically underserved populations. We know this pandemic had a disproportionate impact on our communities of color, and we need everyone involved in this effort at the state and local level to make sure there are plans in place with a strong emphasis on equity. Since vaccines arrived in the state a little less than a month ago, the first doses of Pfizer vaccine arrived on December 14th. We have been in close contact with the local health districts and hospitals who have been administering the vaccine to our healthcare workers. In the last week or so, many counties were making great strides in finishing up vaccines for healthcare workers and are ready to move forward with more vaccinations. There is no doubt everyone has been working so hard, but similar to every other state who has been tasked with completely running the largest vaccination program in history, there have been challenges. Instead of ignoring or denying the challenges we face, we'll be committed to identifying them and finding solutions. We will course correct as necessary and remove any obstacles to get more shots in the arms of Nevadans. In this vein, and after the first few weeks of vaccinations, I asked the best logistical leaders in our state to get together and review what has worked so far, what challenges we are facing, and what we can do as a state to resolve any issues moving forward. This group includes a Division of Emergency Management, the Nevada National Guard, and our state immunization team. This is the same group who worked with our local health and emergency response leaders to address the challenges that we faced with COVID-19 testing at the start of this pandemic. And I am confident they will work to identify challenges, develop solutions, and implement them on the ground. The team right now is working with local partners on the logistics of standing up vaccination centers for our state's most populous locations, looking into expanding who can physically give a vaccine, breaking the data entry backlog issue by repurposing or hiring new staff, and so much more. I'm committed to using every resource available to support every solution that they identify. Fortunately, the latest stimulus package included more funding for state vaccination programs. And while this money will come in at the midst of this operation rather than prior to it starting, we will gladly put it all to good use to assist our efforts. This team I convene continues to look at and make breakthroughs in these challenges daily, and we will be sharing more information on these fronts as it becomes available. We all share the common goal of getting Nevadans access to the vaccine faster. We are limited by certain factors out of our control, including how many doses are allocated to Nevada by the federal government. I know the number one question people ask is, when will I get mine? And trust me, there is no one who wants to provide you with that timeline and that vaccine more than me. Unfortunately, the federal government only provides our allocation amounts for 1 week ahead, putting state and local vaccination teams in an impossible position to predict exactly when prioritization groups will be able to get vaccinated. We have joined other states in expressing this concern to those currently in charge and to the incoming administration, and we will continue to do so. I am hopeful the incoming administration will quickly implement a unified national strategy and employ additional vaccination assistance to states to reflect the urgency of this operation. Until then, we will be relying on state and local leaders and partners throughout the state to do everything in our power to vaccinate as many people as possible on our own as quickly as we can. At this time, I want to turn over the presentation to Ms. Bennett.
Thank you, Governor. It is a pleasure to join you and provide this update. We know people are anxious for information. Through this first piece of the vaccine rollout, when doses were allocated to very specific populations in Nevada and nationwide, we were learning the nuances of the vaccine and developing processes that will serve us as vaccine becomes available to more Nevadans. It was important to protect the health of the public and ensure we were reaching our target population of critical healthcare workforce before moving to other Nevadans. As more vaccine is delivered to the state each week, our communication will continue to increase as we will use all methods available to spread the word on how, when, and where you can be vaccinated. But we must continue to be patient and maintain our mitigation measures until more doses arrive. As of January 10th, 61,644 doses of COVID-19 vaccine have been administered and reported to Nevada WebIZ. This includes more than 8,700 second doses for Nevadans who were the first to be immunized in December. We are excited for this first milestone of Nevadans receiving their second dose of vaccine and being fully immunized. We've talked about how many doses have been administered to Nevadans and how the number grows daily as we learn about the vaccines, streamline the process, and find efficiencies with the required administrative tasks. Data entry thus far has been a challenge. It takes more than 2 minutes for each dose administered to be entered into Nevada WebIZ system. So one person can enter about 30 doses an hour or 240 doses in an 8-hour workday. In the past 3 days, 12,000 doses have been added to Nevada WebIZ, which equals about 400 hours of data entry by Nevadans. We must report to the CDC daily on the number of doses administered. This information is reported as aggregate data. No specifics about the individuals in Nevada who have been vaccinated is shared with the federal government. In Nevada, we have received a total of 170,400 doses of vaccine from the federal allocation, including both Moderna and Pfizer vaccines, with more doses set to deliver early this week. Nevada's allocation continues to be low, and that is why it is so important that we prioritize who can be vaccinated and when. I want to walk through how the federal allocation is ordered and delivered to Nevada. There is a cadence to the vaccine allocation, ordering, shipping, and physical receipt. We have a set amount allocated to us each week from the federal government, and that is the total number of doses we are ordering against. Each week, after discussion with our local partners who are administering vaccine in their community, we place orders for the upcoming week. So as time goes on, we know the amount we can order from, how much is currently on the truck or in transit, how much we have administered to individuals, and the number of doses we have across the state currently available to be used. Since we are always ordering doses a week prior to actually having that vaccine on hand, it does cause a logistical challenge that we continue to discuss with our local partners in order to be able to get vaccine to Nevadans efficiently, without too much vaccine sitting on shelves and with no wasted doses, but without overpromising how many people are able to be vaccinated in a set time. We are working with all Nevada counties on a continuous basis to ensure the doses received are spread equitably across our state. The current limit of supply available to us makes this challenging, but the immunization program is committed to ensuring that all Nevadans in our rural or frontier counties and in our cities, north or south, all have an opportunity to receive vaccine as we move through the distribution plan. We want every dose available to be used, and we know adjusting the administration plan once a vial has been punctured or thawing has begun may occur. Both Pfizer and Moderna vaccines can stay in their original frozen storage conditions for up to 6 months. Moderna vaccine in its thawed state is also stable for up to 30 days in a refrigerator. But these vaccines must be used within 6 hours of puncturing the vial, and vials should not be transported after puncture. Once they are thawed, they cannot be refrozen. All of this complicates the vaccine response. Our goal is to ensure that no dose goes to waste, and the updates to the playbook Candace will talk about describes the flexibility we have added for vaccinators, which better reflects the reality of this dynamic situation. I will now turn it over to Candace to talk more about the third version of the vaccine playbook.
Thank you, Shannon. It has been uplifting to see the response of Nevadans on how eager people are to receive the COVID-19 vaccine. We know it is hard to know the vaccine is here, but not yet available to all Nevadans. As Shannon said, we are receiving weekly allocations and working with all of our local partners to ensure vaccine is reaching all communities in our state. It has been a long process to review the federal guidance and recommendations and complete this updated playbook to provide context on Nevada's plan and guidance for our vaccinators. I want to talk about the changes we've made. So the first being that we are moving away from a tiered structure to focus on lanes of vaccination that will run concurrently. This changes the structure of our playbook and plan going forward, but does not impact the counties already moving into what was previously identified as Tier 2. We know that in Nevada, we are all in this together, and that our workforce, our families, our friends, and our neighbors are all essential. In the revised playbook, we have moved to a model where our essential frontline workers and specific high-risk populations will move into parallel lines. So upon completion of the healthcare workforce and support category, counties will move to vaccinate those 2 lanes concurrently in a prioritized order. The general population lane is prioritized based on mortality, morbidity, and other considerations. We recognize the importance of prioritizing our senior population who have been hit hard by this virus, and we are developing plans with partners to help this vaccination effort. As the governor mentioned, one notable change is that the top priority under our general population is 70 years and older. Previously, it was 75 and older. After the 70 and older, the next general population priority group is 65 to 69 years, followed by Nevadans between the ages of 16 and 64 with underlying conditions. The immunization program has worked with our partners and community groups to identify those with underlying health conditions, and we are using the CDC guidance to identify the specific underlying health conditions that put a person at increased risk of severe illness from COVID-19. Those can be found in the updated full playbook and a new condensed playbook briefing document that will be released after this press conference. At this time that Nevadans with underlying conditions are receiving the vaccine, it will also be available to those experiencing homelessness and individuals with disabilities. We are very proud to be only one of a few states who are specifically prioritizing individuals with disabilities. Finally, the last group under general population is healthy adults between 16 and 64. While this general population lane is occurring in priority order, the parallel line of our frontline essential workforce will also be getting vaccinated in priority order. In the lane of frontline essential workforce, we continue to strive to maintain a science-based approach and an equitable distribution while considering close contact and with those outside your household and the likelihood of transmission. We are talking with business groups, community groups, and organizations across the state to identify barriers and opportunities as this plan moves into action. While there are limited doses of COVID-19 vaccine available, we are relying on Nevada's employers to identify those who are truly frontline and should receive vaccine first, as not every person in each occupational group will be included until more doses are received. In the revised playbook, we have worked to include guidance and details related to Nevada's essential workforce. Again, we are no longer using the tiered approach and have updated the playbook to streamline and simplify the prioritization. Frontline and essential workforce categories are now prioritized in buckets from public safety and security to frontline community support, supply chain and logistics, and more. While most of the prioritization order remains similar to the last version of the playbook, some changes have been made, and critical industries are identified with further guidance, including education, public health, and mortuary services, the end-to-end essential goods supply chain, and food service and hospitality, among many others. We know it's important for our students of all ages to be able to attend school, childcare, and higher education. Therefore, workers in these groups, including the vitally important support staff, have been identified along with other areas of frontline community support. We know many in these fields are not able to do their jobs remotely and are essential to our community. We have also updated the location in the plan for those who provide mortuary services in our state. This essential function has been impacted greatly as communities statewide are suffering from those lost to COVID-19. Another key group that additional guidance has been added for is Nevada's end-to-end essential goods supply chain, which takes into account all the people involved in moving an essential item such as baby formula, food, hygiene products, and more from where it was created to where it is sold, manufacturing, transport, distribution, and sales. Additionally, we have proudly added a new bucket called Frontline Commerce and Service Industries, which includes the food service and hospitality workforce. We know Nevada is the hospitality capital of the world, and as the governor has said many times, they are essential to our state and our ability to be healthy and recover. This will include those working hard in these vital industries, from restaurant staff to food prep to frontline casino and resort employees. Again, this updated structure offers flexibility for those working in our communities to ensure all doses are being used, while still maintaining an order of operation to the rollout of vaccines across different groups. We are not receiving enough vaccine each week to move in a standard fashion across all counties, so some areas will be advancing more quickly than others. The full playbook includes many other updates and additional guidance to help our counties, our local health authorities, and other vaccine providers and businesses working to support Nevada through the vaccine rollout process. This playbook continues to be a fluid document that may be updated in the future as more guidance is provided. And I want to be very clear about one thing before I turn it back to the governor. If you heard your workforce or age announced today, it does not mean that vaccines are available today. When counties are ready to vaccinate different categories within these two lanes, we will work with them to ensure that you know. Please wait for the communication from your state and local leaders. We know that you are eager to get this vaccine, and that's great, but please be patient, and we're going to ask just to wait for a little while longer. Thank you, and I will now turn it back over to the governor.
Thank you, Candace and Shannon, for being here with me today and providing that valuable update. We know Nevadans are anxious to know who, when, and where. We also know the federal government has made it difficult for states to provide some of these answers. But here in Nevada, we're fighting to find solutions for all of you every day. I know this incredible group of health leads, emergency managers, and the Nevada National Guard are up to the task of doing all we can at the state and local level to communicate effectively with all of you. They're building the largest vaccination operation in our state's history, and I know it will be something that all Nevadans will be proud of. At this time, I'll turn over to my staff to help facilitate some media questions. Thank you for joining us.
Thank you, Governor. This is Megan Delaney in Governor Sisolak's office. We'll do Q&A through the raise hand function on Zoom. So if you're a reporter who's on the call who has a question for one of our speakers, you can raise your hand and we'll call on you one at a time, please. We'll go Riley Snyder from the Nevada Independent for the first question. Riley?
Hi, Governor, can you hear me?
I can, Riley. Yep.
Great. Thank you so much for taking the question. I wanted to ask, from your prepared remarks, it looks like Nevada has administered 61,000 doses of the COVID vaccine out of about 170,000 doses of vaccine received. Are you satisfied with how fast the state has been in getting shots in arms and getting the vaccines out the door? Or do you think there are ways that the state could improve that process or get them out faster?
Well, I guess I'm never satisfied with how quickly we get the vaccines into arms. We need more flexibility from the federal government. We need more consistency in terms of the vaccines that we're getting and the delivery. And our partners, our local partners, we're partnering with them to make sure that we can get it administered as quickly as possible. Understand, when you're only getting notified a week in advance, it's hard to know exactly what you've got coming, but I'll give it to Candace and Shannon if they can add anything.
Thank you, Governor. The only thing I would add is just that we are working with our partners to analyze the data, understand the process, and what we can do to improve it.
Thank you for the question, Riley. Thank you, Governor and Shannon, for providing that answer. We'll go to Vanessa Murphy, Channel 8 next. Vanessa?
Hi, Governor Sisolak. Thank you for taking my question. It seems that Nevada is behind other states, though, in getting the vaccine out. States which are much larger seem to have a better hold than we do. Why is this, since we have known that we would need a vaccination plan, and why has it taken so long to come up with this newer playbook?
Well, it hasn't taken so long, Vanessa, really to come up with it. You know, we've been planning this for a long time. We did not have the resources. Nevada simply does not have the dollars, the monetary resources in order to set up plans like some of the other states do. But I think if you look at the total percentage of vaccines that we've given out as it relates to other states, I'm not satisfied, but I'm proud of everything that our frontline workers have done.
Thank you, Vanessa. We'll go to the next question from Bill at the RJ. Bill?
Thanks, Megan. Hi, Governor. Thank you. Could you address one more time the communications efforts? The person who's in their low 70s, how are they going to find out exactly when they're going to be able to get a vaccine?
Thanks for the question, Bill. Candace or Shannon, do you want to handle that one?
Yes, thank you, Bill. This is Candace. So at this point in time, and I think one of the really important aspects of this entire vaccine response is continually evaluating how we're doing and being able to address these challenges and come up with really great resolutions. So at this point in time, what we're really working on now is that we want to have a very centralized place where anyone in the community can access to see what's happening. And so as we sort of mentioned previously, as we know the when and the who and the how, we are very committed to using every single mechanism of communication to get that exact information to the population that needs to get it.
Thank you. We'll go to Tiffany Lane, which I think is News 3. Tiffany, if you want to ask your question.
Hello, Governor. Thank you for taking my question. We saw an FBI bulletin that came out saying that there could possibly be armed protests planned at all 50 state capitals leading up to the inauguration. What is your message hearing this, and what are the safety calls being put in place in case we do start seeing this happening?
I'm aware of the issue that you're speaking about. We've got a task force that's assembled that deals with security issues, and I can't get into specific precautions that are being taken, as you obviously understand. I ask people to understand that, you know, protesting is fine, but what happened at the Capitol is simply not acceptable. It's not acceptable if it happens in Washington, D.C., or it happens in Carson City, or anywhere for that matter. And we're hoping that people will protest in a responsible, peaceful manner and not take to violence or mob rule.
Thank you, Governor. Thank you for the question. We'll go Andrew Davey. I think Nevada Today is the outlet. Andrew?
Yes, hello. To follow up on an earlier question, considering what we've been, what we've been seeing for nearly the last week since the attack on the U.S. Capitol, are you concerned at all about potential future attacks here in Nevada, including any potential violence that could affect vaccination efforts?
Well, I'm always very concerned. We have a task force that's set up that handles this. It's a concern that always is on my mind. But, you know, with the protests that we had this past week in Carson City was peaceful. We had 2 minor arrests for unrelated activities and 1 arrest later that evening. But I'm confident that our law enforcement agencies, who go above and beyond and deserve to be given an awful lot of credit for keeping the peace, as I said in my remarks about what they did at the Capitol. And we're confident that they'll be able to move that to maintain that moving forward. But we need to get past this and onto it was an election. The election's over. It was a fair election. And now we need to continue to govern.
Thank you, Governor. Sorry, I think I accidentally muted you a bit in your question there. So glad that you were able to unmute yourself. We'll go to Lauren Martinez from Fox 5 for the next question.
Hi, Governor. Can you hear me okay?
Sure.
In a recent article, Nancy Messonnier from the CDC said she's encouraging providers to use their full supply of the vaccines, even if people wind up getting the shots ahead of their spot in line. In this press conference, you mentioned that the goal is so no dose goes to waste, you avoid unused vaccines. How will providers go about that?
We're giving providers as much flexibility as we can to administer the vaccines, whether they have an alternate list or whatever it be. The goal is they have no vaccine, no dosage go to waste. And that's what we've got policies in place for. But Shannon or Candace, if you want to jump in here.
Yeah, thank you. So this is Candace. I would say at this point in time, we're really dependent upon sort of the data that we're finding out of this. And really, because we have to rely on the federal government who holds back that second dose. And I think really only getting a weekly cadence, it's really difficult to make that sort of decision at this point in time. And if Shannon has any other additional information.
We are working with our partners across the state to ensure that every single dose is administered and that we are not wasting any doses in every one of our communities and allowing the flexibility in order to do that.
Thanks for the question. We'll go to Mary Hines from the RJ next. Mary.
Thank you. The 70 plus age group is a large group of people. What is your best estimate in terms of how long you think it will take to get through that group? And also, when might those vaccinations begin? And lastly, did CDC recommend 70 and above?
There's a few questions in there, Mary, so I think we'll pass it over either to Shannon or Candace to try to capture all of those.
Sure, thank you. I can take that one. So we are anticipating, we really can't say a definitive timeline as to when we think these vaccines will start in this particular population, because we are simply only finding out our allocation week to week. So we do not know what we're going to be getting in the coming weeks. So I don't have a definitive timeline to share with you today, unfortunately, and I'm not certain, because I don't know the allocation, how long it will take to get through those groups. We will be able to communicate more information shortly, and I know a lot of this is happening in some of the local communities as well that are maybe starting on some of those population groups. And the CDC's recommendation was 75 and older, with states' flexibility to do what was best for their state.
And Mary, I want to jump in here. I felt very strongly about moving it to 70. Oftentimes you've got spouses, one is under 75, the other is over 75. But in our statistics and the data that I looked at, we looked at considerably, the majority of the hospitalizations and unfortunate deaths come in the group from 70 on up. And I didn't want to make that delineation line at 75. We want to give the local jurisdictions more flexibility. So that's why we moved it to 70. To capture as much of that population as we can.
Thank you, Governor. We'll go to Lucia Starbuck for the next question.
Hey, I have a question. So do we have the infrastructure in place to mass vaccinate? Last week, the Washoe County Health District said that they do need help dispensing the vaccine. So if we need that help, what needs to be in place? And can you also comment on how vaccinations at long-term care facilities are going as well?
Right, so this is Candace. I will start on essentially truly supporting where we're at a place right now where we need to scale up our response. And so thankful to the governor to really bring this team of logistical expertise together and then hand in hand really support our counties to make sure that we can meet this need. And then I'll hand it over to Shannon Bennett to talk about the long-term care.
Sure, thank you, Candace. We have seen a slower rollout for our long-term care facility vaccination efforts. However, in analyzing the data, we have many appointments scheduled over the next few weeks, including this week, in our assisted living facilities, and really wrapping up those first appointments for our skilled nursing facilities. Our assisted living facilities just started last week, so we anticipate that will pick up rapidly in the coming weeks. And we will continue to analyze the data and make any course corrections as necessary.
A lot of the situations which you're speaking of arose also with the COVID testing. And it was through the collaboration of our hospital partners, our medical partners, the National Guard, and our frontline folks that we could expand that rapidly. And that's the same position that we're in. Just like when the testing came forward, we didn't have a plan coming from the federal government, and the state had to adapt. Now the same thing has happened with the vaccinations. The federal government didn't give us a plan, and we're having to adapt, but we're doing it as quickly as we can, and confident you're going to see a lot of them going out quickly.
Thank you, Governor. Thank you for the question. Sam Metz from the AP, and I think we'll start to wrap it up here.
Hi, thank you for taking my question. So the threshold right now to move on to tiers was an 80% vaccination rate. Are the changes to lanes partially motivated by a realization that that threshold was so high that it slowed things down?
Candace or Shannon, do you want to take this question from Sam?
Yeah, absolutely. Thank you, Sam. And I think after all that feedback that we received from local vaccinators, and really when it came down to the reality of what happens to week, they truly need sort of that additional support within the framework of the playbook to make those adjustments as they see fit. Obviously, always using the prioritization structure, but we really had to meet that need of flexibility.
Thank you for that. And I think, Governor, we'll pull your press conference to a close here. We'll have the newest version of the playbook sent out later tonight. It'll also be on nvhealthresponse.nv.gov. So Governor, if you have any closing comments before we end the press conference today.
No, I want to thank everyone for joining us this evening. What's most important aren't the vaccines, it's the vaccinations. We need to get these vaccinations in people's arms. I'm really proud of the team that we've assembled here to make that happen. The logistics of ramping this up are a lot more complicated and complex than sometimes people realize, but I'm confident that we can do it. I'm confident that we can do it. We're battle-born in Nevada, and we will come up with a way to take care of our most vulnerable people and our frontline essential folks. We're all essential. Everybody's all essential, but we need to keep our economy moving, get our classrooms open, and take care of our vulnerable population. So that's what we're headed on doing. Thank you all for joining us this evening.